Assalamualaikum. My name is Sibha Abbas, batch representative of batch 26. Our topic of research is systematic review, and these subheadings are mentioned on the side of the slide: title, abstract, introduction, methods, quality assessment, prisma, tabulation results, and conclusion and references. Abstract will be presented by Shiza Amjad, roll number 144.
Assalamualaikum, I am Shiza Amjad, roll number 144, and I'll be presenting abstract of our study. We will start with the background. Consanguineous marriages are the marriages within the family, that is between two first cousins. It has been discovered that a greater risk of developing congenital defects in progeny is observed if the parents are related. In Pakistan, due to cultural and religious trends, marriages within the family are rising with time, and this leaves Pakistan among the top few countries which have been a common interest of investigators, social scientists, medical researchers, biologists, and physicians who are interested in congenital abnormalities that are inherited from consanguineous parents. The goal of our study is to evaluate the prevalence of congenital defects in children who are a result of consanguineous marriages in the region of Pakistan, and also highlight the possible hindrances in further investigation and prevention of congenital defects in the children of related parents. Methods: we looked for, gathered, and assessed literature that reported the prevalence of congenital defects in children of consanguineous marriages in the region of Pakistan from 2014 to 2022 on PubMed, Google Scholar, and Cochrane. Combination keywords such as consanguineous marriages, consanguinity, congenital defects, congenital disorders, congenital malformations, congenital diseases, congenital disabilities, and Pakistan were used. Full text original studies in English language done from 2014 to 2022 were included. The search was carried out in accordance with PRISMA standards. Results: we identified 9 articles which met the criteria set for selection based on our topic of research. The results showed that there was a significant increase in congenital abnormalities if the parents of that child were consanguineous. Consanguinity influenced the number of stillbirth and abortions as well, and in children born to such parents, 2 to 4% of live birth had congenital abnormality of physical, mental, or cosmetic origin. It was analyzed that parents who were first cousins had greater incidence of having a congenitally inherited abnormality than second or third cousins. There were far less chances of developing congenital disorders in children whose parents were unrelated. Conclusion: it is concluded that the parents who are related by blood have a higher incidence of having babies with mental retardation, congenital deafness, congenital heart disease, and various other autosomal recessive disorders. Therefore, it is the need of the hour to create public awareness to lower the risk of congenital defects and improve the facilities of genetic testing in Pakistan for early detection and improvement in the living standards of affected children. Keywords: consanguineous marriages, consanguinity, congenital defects, congenital disorders, congenital malformations, congenital diseases, congenital disabilities in Pakistan. Thank you so much.
Assalamualaikum. My name is Sibha Abbas, roll number 146, and I will be presenting an introduction. Introduction: what is consanguineous marriage? Consanguineous marriage is the marriage within the family between first two first cousins. The hallmark of consanguineous marriages is the congenital defects among offsprings. Pakistan has been showing the highest trend of consanguineous marriages. Consanguineous unions have remained under continuous investigation by social scientists, medical researchers, biologists, and physicians. However, it received less attention in mainstream demographic research. Major congenital abnormalities or birth defects carry significant medical, surgical, cosmetic, and lifestyle consequences. Overall, 2 to 4% of live births involve congenital abnormalities, the risk for birth defects in the offspring of first cousins is substantially higher than in the offspring of non-consanguineous parents. An investigation of the trend of consanguineous marriages in Pakistan from 1990 to 2018 presented its strong association with increased rates of abortion, stillbirths, pregnancy termination, low birth weight, increased mortality, and congenital malformation. The the detrimental recessive gene expression in consanguineous progeny has contributed to overall disease profile in both developed and developing countries and has highlighted potential genetic problems. The study has established a significant role of parental consanguinity in congenital heart diseases. However, clinical and audiological studies of patients with progressive sensory neural hearing loss was carried out and showed a role of consanguinity. A study also showed that 66% of patients with auditory neuropathy spectrum disorder were born of consanguineous marriages. This study is substantial as prevalence of consanguineous marriage may significantly led to various health-related implications. Since consanguineous marriage is one of the major causes of congenital defects and physical disability in newborns, this research wants to address this issue in society. The rationale is to spread awareness among the public masses about the aftermath of this issue. Being more prevalent in Muslim community, consanguineous marriage are considered quite normal, thereby promoting screening can help diagnose aberrations earlier. The objectives of this study is to determine the prevalence of congenital defects among consanguineous marriages in Pakistan and to determine the factors associated with increasing consanguinity ratio among Pakistani population.
Assalamu
Methods.
alaikum. Assalamu alaikum. My name is Rizwan Zafar, roll number 293. I will be presenting methods of the study. Strategy: the search approach adhere to the preferred reporting items for systematic reviews and meta-analysis. Prisma checklist 9 and the Prisma guidelines were followed throughout. An extensive systematic search of the electronic databases PubMed, Google Scholar, and the Cochrane Library was undertaken. Studies done between 2014 and September 2022 were selected. Combination of the following terms were used for the search. Category 1, population, children of consanguineous marriages, couples of Pakistan. Category 2, diseases, congenital defects and congenital diseases. Category 3, prevalence or epidemiology. With the search criteria mentioned above, a new search was run on each electro search engine one by one. Additional publications were found by manually searching the reference list searches. The articles were added on the Mendeley desktop and duplications were removed. Initially, the articles were reviewed on the basis of title and abstract, followed by full article reviews. Methods: inclusion and exclusion criteria. Exclusion criteria: all the articles with language other than English were excluded. All the articles with population other than Pakistani population were excluded. All the articles whose full article wasn't available were excluded. Next slide, please. Inclusion criteria: cross-sectional study, population, Pakistani population, consanguineous marriages, couples and their children, studies involving congenital defects among them.
Assalamu alaikum. My name is Tuman Ahmed, roll number 290. I will be presenting Prisma flow chart of our research. So we use three databases: PubMed, Science Direct, and Google Scholar. From PubMed, we got 587 articles. From Science Direct, we got 290 articles. And from Google Scholar, we got 114 articles, and a total of 991 articles were screened. The duplicated articles were 3, and after that, we were left with only 988 articles. And after the title and the abstract screening of these articles, we were left with 81 articles, which we carried out the full text screening. And after full text screening, 9 studies were up to the mark to be included into this research.
Assalamu alaikum. My name is Ryan Qayyum, roll number 292. I will be presenting study findings table. After full text examination, data was extracted and tabulated by following headings: title, author names, journal, database, type of study, year of publication, population on which study was conducted, and then main focus was on prevalence of consanguinity, incidence of children with congenital defects, correlation with parental education and socio-economic status, and then last were limitations of the study and methods of data collection used. I will be giving you brief overview of all the included studies one by one. First study was causes of deafness in Punjab region of Pakistan and role of consanguinity. It was an observational study with overall prevalence of consanguinity 80% and percentage of deaf males was 0.2 to 0% and 0.181% of females were deaf. Limitations were language barrier and limited population included. Next study was knowledge of consanguinity and its associated risks in rural community of Char Sadda, Khyber Pakhtunkhwa. Prevalence of consanguinity was 57.67% and 35% of children as a result of consanguineous marriages suffered from genetic disease or postnatal death complications. Low socioeconomic status, family pressure, and cultural norms were also related to consanguineous marriages in this study. Limitations were again time constraint, language barrier as majority of the population was illiterate. Next study was diagnostic and perinatal outcomes in consanguineous couples with a structural fetal anomaly. It was a retrospective and partially prospective cohort study with overall prevalence of consanguineous pregnancy 62%. It was conducted on UK-based Pakistani population. Risks of perinatal death was greater in consanguineous group, as was the risks of fetal structural anomaly. Limitations were selection bias. The study took place over a decade and results cannot be concluded for Pakistanis or Bangladeshi Muslims. Next study was prevalence of congenital disease among consanguineous marriages in Peshawar. It was conducted in OPD departments of different private and public hospitals of the Peshawar. It was a cross-sectional study and 4.8% children showed Down syndrome followed by congenital heart defects, thalassemia, mental retardation, and Charcot-Marie syndrome. Limitations were again time constraint and language barrier as most of the population was illiterate. Next study was association of consanguineous marriages with congenital birth defects. It was a case control study conducted in gynae department of Holy Family Hospital, Rawalpindi. No correlation was found with socio-economic status or parental education. Limitations were only patients presenting to a certain hospital OPD were taken into study, and an age group was selected 18 to 35 years old, which was targeted in this study. Next study was on consanguinity and neural tube defects. Again, it was conducted in Holy Family Hospital, Rawalpindi. It was a case control study. Majority of the patients had low socioeconomic status. Limitations were again only diagnosed patients were taken into the study. A performa was filled and there could have been a language barrier as majority of the patients were illiterate. Next study was estimating inbreeding depression on cognitive behavior, a population-based study of child cohort. It was conducted on Muslim population of Jammu region. It was a cohort study and the ratio of consanguinity was 9% higher in people of low socioeconomic status. Method of data collection in this study was IQ tests were performed by a person and data was collected and recorded on the questionnaire. Limitations were only Muslim population was selected and child cohort of 6 to 15 years old was selected only. Second last study is effects of consanguineous marriages on perinatal outcome. It was conducted in Park Emirates Military Hospital. It was a cross-sectional study. First cousin marriages accounted for 31.1% of total marriages. Second cousin marriages 14.3%, and not in relation were 54.6%. Consanguinity had significant association with threatened preterm labor. Last study of out of 9 is analysis of frequency of congenital fetal anomalies diagnosed on antenatal ultrasound in tertiary care hospital of Balochistan. It was conducted on patients presenting in Department of Radiology in Bolan Medical Complex, Quetta. It was a cross-sectional study, and it showed that mothers of age 25 to 29 had greater prevalence of cases as compared to other age groups. Most cases were related to CNS abnormalities, and mothers taking folic acid had less incidence of congenital defects as compared to others. Limitations were only the cases presenting in hospital were included in study, and ultrasound was used as means of diagnosis only. Thank you.
Assalamu alaikum. This is Shansa Hafiz, roll number 142. I'll be presenting quality assessment. Assessing the quality of evidence contained within a systematic review is as important as analyzing the data within it. Quality assessment tools are questionnaires that are formed to ask specific questions about the methodology of study. There are many tools but are chosen according to the study type. For this study, we have used Joanna Briggs Institute JBI scale, which contains various checklists. Here we have used a checklist for prevalence studies. In this study, each paper was initially screened and analyzed separately by two authors before being included or excluded. Articles were further evaluated by other 5 authors to see whether they met the inclusion and exclusion criteria. Titles and abstracts of each publication were initially reviewed to see if the selection criteria were met. The complete text of any article that didn't fit these requirements weren't obtained and were excluded. When there was a difference of opinion about the eligibility, the 4 authors reasoned and decided whether or not to include or exclude that specific article. Thank you.
Assalamu alaikum. My name is Shavana Imam, roll number 143. I'll be continuing with the critical appraisal. So as told earlier, the JBI, Joanna Briggs Institute critical appraisal tools were used for the assessment of the studies. All the studies that fulfill the eligibility criteria were included in the review regardless of their quality assessment results. So looking at the table, the Joanna Briggs Institute score addresses 9 questions, which are answered as yes or no, and then a Joanna Briggs Institute score is given to each study. So the question number 1 was the sample frame appropriate to address the target population? 2, were study participants sampled in an appropriate way? 3, was the sample size adequate? 4, were the study subjects and the setting described in detail? 5, was the data analysis conducted with sufficient coverage of the identified sample? 6, were valid methods used for identification of the conditions? 7, was the condition measured in a standard, reliable way for all participants? 8, was the appropriate statistical analysis? And 9, was the response rate adequate? And if not, was the low response rate managed appropriately? So with these 9 questions, our 9 studies were evaluated and a JBA score was given to each study. And the results were as follows. 4 of the 9 studies were of very good quality, having a JBI score of 9 out of 9. 4 were of good quality, having a JBI score of 8 out of 9. And only 1 study was of average quality, having a JBI score of 6. So that concludes our part on critical appraisal. Thank you.
Assalamu alaikum. My roll number 145. I'll be presenting the discussion of this research. Liaquat A in 2016 reported that the consanguinity in the population of Nahaki was estimated at 55.67% and the mean age of marriage at 19.05 with a difference of 3.06 years. Nusrat Numan in 2016 conducted a study according to which consanguinity is dependent on socio-cultural, geographical, and religious diversities. Consanguineous marriages increases the rate of homozygosity, which is one factor for congenital malformations like spina bifida and encephaly and hydrocephalus. Rabia Riaz in 2016 reported that about 20% of the world's population live in communities which consider consanguineous marriages as a preference. And in Pakistan, cousin marriage is favored all over the country, and the link between cousin marriage and birth defects was found to be significant. Jisrani A in 2019 reported that the prevalence of congenital malformation varies from region to region and can be life-threatening. One study found that the musculoskeletal anomalies are the most occurring anomalies, followed by skin anomalies and genitourinary system anomalies in Iran.
This is Nafis Ahmed, roll number 289, and I'll be representing the next half of our discussion. Sibghatullah and others conducted a study in the Punjab and stated that the number of families with recessive hearing loss due to homozygous mutations would decrease by 99% if the families were non-consanguineous. The genetic analysis revealed that consanguinity is responsible for the prevalence of deafness. The cases of deafness can be prevented by proper counseling of families and premarital genetic testing in cousin marriages. Dr. Finola Moon and others compared consanguineous and non-consanguineous pregnancies with fetal structure anomalies in a UK prenatal genetic clinic from 2008 to 2019. Most consanguineous couples were of Pakistan ethnicity with an odds ratio of 29. The risk of perinatal death was greater with an odds ratio of 3 in the consanguineous groups, as was the risk of fetal structure anomaly recurrence in a subsequent pregnancy. Abira Chaudhary and others conducted a study in Pak Emirates Military Hospital, Rawalpindi. In 1381 participants included first cousin marriages accounted for 31.1%, second cousin marriages for 14.3%, and those not in any relation were 54.6%. Significant association with consanguinity was found for threatened preterm labor, preterm delivery, nursery admissions, and neonatal outcomes. Mohat Freed and others conducted a study with detailed effects of inbreeding on the cognitive abilities of children. Results showed a significant decline in cognitive abilities of children due to inbreeding and higher frequency of mental retardation observed among offspring of inbred families. A familial study has reported that the incidence of mental retardation among the children of first cousins being 4 times greater than in the control group. The study of Morton revealed similar results. Navida Sarwar and others conducted a cross-sectional study in the rural population of Khyber Pakhtunkhwa. More than 97.3% of people reported cousin marriages in their extended families, and the main reasons were family pressure, low socioeconomic status, and lack of awareness about the reproductive dangers associated with it. More than 29.7% of the people knew about the risks associated with consanguineous marriages, and only 4.3% had undergone blood testing for a genetic status before marriage. We need to create mass public awareness through media and reach out to rural areas to educate these people about the reproductive risks associated with cousin marriages. And now with the comparison to the other studies, Muhammad Yunus and others mentioned that the rate of consanguinity is high among the Muslim community around the world. Many rare genetic disorders and new genetic syndromes, congenital malformations, morbidity, mortality, and reproductive wastage have been observed to increase frequency in the consanguineous marriages. Similarly, Muhammad Freed stated that more than 1.2 billion of the current global population practice consanguineous marriage. The most common form of consanguineous union is contracted between first cousins, in which the spouses share 1/8 of their genes inherited from a common ancestor, and so their progeny is homozygous at 1/16 of all the loci. Parental consanguinity has been associated with increased risk of adverse prenatal outcomes and many other complex disorders. Thank you.
name is Rana Farman, and I'll be presenting the strengths and limitations of our research. The strengths include the rigorous methodology used, accomplished according to the published protocol. The search strategy was carefully developed and comprehensive in nature. The limitations of our research include review was restricted to articles covering period from 2014 to 2022 to give more relevance to current situations and for purpose of planning realistic interventions. All the studies added in the review were cross-sectional and have different sample sizes. Moreover, more high-powered studies are needed to find out the prevalence of congenital defects among consanguineous marriages in Pakistan and would be needed to fully address this topic.
Conclusion: increased risk of congenital defects among consanguineous marriages in Pakistan, enhanced risk of developing physical and mental abnormalities. There are higher threat to suffer from mental retardation, congenital deafness, congenital heart diseases, Charcot-Marie-Tooth syndrome, and autosomal recessive disorders. There is a dire need for mass awareness campaign and counseling sessions among the public to improve genetic testing facilities for early detection of possible diseases and improvement in living standards of children. These are the reference of our research. I'm very thankful to head of department, Dr. Saira Afzal, and Dr. Faria Salman for supervising us throughout